Welcome, and thank you for joining us for the Living Well with Chronic Conditions Revival presentation. I am Jill Rankin with the Wisconsin Institute for Healthy Aging. Happy to be talking with you about this subject today. This program is near and dear to my heart as I've been working with the program for over 11 years now. I've had the privilege to be able to lead classes myself, as well as be a master trainer for the program, and have the privilege of traveling around the state of Wisconsin and seeing all of you all do programs with Fidelity Coaching and just seeing the magic that this class has. So as you go through the presentation today, you're going to hear tips from both Michelle and I, things that we've learned from both here in Wisconsin as well as nationwide, and we're excited to be sharing those with you today.
Hi and welcome. My name is Michelle Kamal. I'm also with the Wisconsin Institute for Healthy Aging. I've been a part of the Living Well with Chronic Conditions programs for about 9 years, also having the privilege of being a leader and a master trainer as well as a coordinator. So yeah, we have a lot of experience and tips to share, and then we hope it continues a conversation about your experiences going forward.
So why a new approach to Living Well? Living Well has traditionally been a hard program to recruit for in many communities here in Wisconsin, yet it continues to be a popular and much needed program because of its excellent health benefits and because of its life-changing impact for participants. We all know the program, we all love the program, but it is worth it, but it has been difficult to recruit for. So this is why Michelle and I decided that we would like to really take a thoughtful approach to reviving it and kind of twisting things around here in Wisconsin to figure out how we can get more energy behind the program as well as more participants. Wisconsin numbers of Living Well workshop have decreased, or they've even stayed the same over the past 5 years. And we're going to show you some numbers later in the presentation. But we definitely need to change this. We think sometimes it could be due to other programs coming on board, but still the program is very valuable. It's needed in our communities, and its spot hasn't been taken up by other programs. So this is why we feel the need to talk about a new approach. So a reminder of the need, we all know that it has excellent benefits, but just wanted to go through those today just to revive us all. We know that 80% of older adults have at least one chronic condition and 50% have two or more. It's very common. 95% of healthcare dollars spent on older adults attribute to chronic conditions, which is basically all. 2 out of 3 deaths in the United States are attributable to heart disease, stroke, cancer, and diabetes. And then specifically in Wisconsin, we know that 14% of the population report fair or poor health. An average of 3.4 days a month reported poor physical health, 3.5 days a month reported poor mental health. So that's quite a significant amount. We have some other information on here just about specific to arthritis. We know people who take the Living Well program do have arthritis. A large majority of them. 1 in 4 adults are diagnosed with this condition. And then cardiovascular disease is also something that people commonly report when they take the Living Well program that they are dealing with. It's the #1 cause of death for adults in Wisconsin. And even in 2009, direct and indirect costs for diabetes was 6.1 billion. So that just gives you a little bit of snapshot of some of the more prevalent health conditions that people report when taking the program are a significant health issue here in Wisconsin. Yet, our Living Well program, coordinated through WIHA and done throughout the state, is only reaching 1% of Wisconsin population. And we all know how beneficial the class is and life-changing it is. So we definitely would love to see that number increase so that more people can experience the life-changing benefits. And why is it a great intervention? We know that it not only has these life-changing benefits, but it's high level. So we know that the results are going to yield regardless of where the program is taught and who is teaching the program, facilitating the program. We know that they're going to get the same results. The program significantly improves people's lives, like significantly improves their lives, not only in the way that they feel and the changes they make, but decreasing pain, depression, shortness of breath, increasing confidence and healthy behaviors like exercise and healthy eating, but it also decreases our healthcare utilization. So we have seen 27% reduction in average emergency department visits within the first 6 months following the workshop. 21% reduction in average emergency department visits in the first 12 months following the intervention, and then a 22% reduction in average number of hospitalizations in the first 6 months post-intervention. So this shows that that self-report is definitely there, as well as the actual health outcomes.
And WIHA has a lot of great handouts and resources outlining these data points on our website. And also something I want to touch on is the research that compares those who did take the workshop to those who didn't take the workshop. It kind of falls in 3 categories of outcomes. We have improved health behaviors like exercise, cognitive thinking, and symptom management, coping and communicating with your physicians. Also improved health status. So that's self-reported health, fatigue, disability, social role activities, and health distress. And then also, like Jill talked about, the decrease in healthcare utilization and expenditures. So the length of stay, the visits, and things like that. So these are all really important components of the outcomes that come out of the Living Well program. And then it also goes beyond health improvements, where it helps with that social aspect of dealing with isolation and loneliness, and that's a huge component as well. So all these incredible outcomes, it's just a great reminder of the pitch and the need for these programs. All right, so I wanted to talk a little bit about the numbers and where Wisconsin has been at. In the past, we've seen about 100 or more workshops held in a given year. And then last year in 2017, we've dwindled down to 66. We've seen less cancellations, but still a high percentage or a high number of canceled workshops. We talked about the 1% of penetration throughout the state, and so there's still a huge need and people out there that could utilize these workshops. Our best guess for the decrease is we brought on the Healthy Living with Diabetes program in 2014, and so that could be one of the components for the decrease. You know, leaders getting cross-trained and then doing the diabetes program, but also it's a hard program to identify and motivate people to take. What is a chronic condition? I don't have a long-term health condition, things like that. And so just the messaging. And so again, today what we want to talk about is different approaches and concepts on how we can bring those numbers up, and small things to do that has a larger impact. That maybe if you don't have a lot of time on your hands to do, you can do some small things to encourage awareness about these programs.
And just to add to the numbers, knowing that here in Wisconsin we're dealing with some decrease as far as Living Well classes going on, but nationally this has been a pattern for other states as well. Yet at the same time, this program continues to grow, not only nationwide but worldwide. So it's quite a balance between getting people to identify with the class and recruit participants and get that reach up there, with also knowing that it has such a high quality health benefit to it that we definitely it's not dying in the sense of the worldwide reach of it. So let's get into concepts. Let's start with what we're thinking as far as how do we revive the program. So concept number 1, regardless of any strategy you're using, we want to point out that it's important to describe the program with excitement and enthusiasm. You all probably know people that could sell a telephone book to people because they're excited about it. And the same thing goes with Living Well. We know that when somebody can communicate the program, not the details and the logistics of it, but just communicate the general gist of the program with excitement, like they've had personal experience with it, usually is where that excitement comes from, that people, it's contagious. People will continue to sign up. They'll say, where can I get that class? And it really makes a big difference. So areas that are successful do have an advocate who really know and believe the program. And we've seen this throughout Wisconsin and nationally, where there is someone who's communicating energy and care for the program when recruiting and participants. That's where it works. And Another key ingredient is having a simple elevator speech where someone can describe the program effectively and simply. And this is just something that you can do in a grocery store. And we say elevator speech because you do it quickly, but just somebody who is a champion for the program. And that's really what that means, is having somebody who has energy in it, can communicate about it, and just has a simple way to describe it. So it's not too complicated.
Yeah, and when you think about what your enthusiasm or energy is going out, even if you get a little nervous in front of presentations, you really want to be motivating, informing, empowering, and relatable to those listening to whether it's a larger presentation or a simple elevator speech. But you just really want to be engaging.
So also know your audience and what speaks to them. So we talk about the program with enthusiasm, but then who are you talking to? You can tailor and adapt your message depending on who you're talking to. So what's in it for them? What's the value of the workshop to them? And you want to do that to potential participants or potential community partners, potential organizations that might want to get on board to start offering the programs in their communities. But really think about it. What's their mission? What's really behind their motivation, behind the work that they do? And relate that to the program. How does Living Well connect with what's in it for them? How does it help them out? How does it help them reach the participants that they want to reach, or increase the health education that they're working to do? And always be sure to connect with your listener. The hardest sell for Living Well recruitment is identifying that this workshop is for them. So we know that through motivational interviewing and other strategies, that listening to what their motivations are is going to be the key. And then, of course, convincing them it's worth their time and interest. Talking about how it was worth your time and your interest and your experience, and then connecting that to them. And then understand the barriers or unique accommodations that this potential participant or partner has is key, and acknowledging that. Different communities have different challenges and different barriers, and even different participants might have different life challenges, whether it's transportation or family members that they're caring for, or other kind of social determinants of health issues. Acknowledging those and figuring out, basically problem solving, to figure out how to overcome those barriers so that they can access the resources of class.
And in just this one slide, I can already see other information videos that we can create and make to help you with making that case to the potential participant or the community partner, value propositions to potential partners, as well as another informative video about different challenges or barriers or accommodations. So things to come.
Okay, so we talked about Living Well, an elevator speech for Living Well. And I'd like to give you a little example. This is one actually that I use from my personal experience, and you can see it up on the screen, but just kind of showing you that when I'm talking with people, whether it's on the phone or in the grocery store or to a family member, I just start with, Living Well is an amazing program. I think every adult should take it at some point in their life, because the goal is to help people better self-manage whatever they're going through. This is why it applies to everybody. So over the 6 weeks, we talk about many different topics that are going to help us more effectively deal with our health and disrupt our health issues. But not only is it informative, it gives each participant a chance to succeed at taking small steps towards their bigger goals, like stress reduction or better communication, sometimes how to eat right or exercise more, regardless of whatever you're dealing with in your life, whether it's a health issue or a stress issue. I actually took it when I was pregnant, and it made a huge difference in my life. And even now, it still helps me minimize pain and frequency of my migraines. So I'm super grateful for the class, and you should definitely sign up.
All right, so testimony. I really want to encourage you to gather it, and then what do we do when we use it? So testimony really helps people identify with those who have taken the workshop, and really getting a feel for what the workshop is about, and and a way to capture that sense or feeling about it. So how do we get it? We got to ask. Leaders, you are the front line to story sharing. You see these transformations that happen over the course of the 6 weeks, and so it's really, really important to make note of that, ask permission, and capitalize on those impactful stories and outcomes, because that's what's going to really sell the program to partners and other participants to identify, well, if they can do it, I can do it too, or wow, that's really tremendous that only happened in 6 weeks. So how and where you can capture it, I have leaders there. I have the exit evaluation. This is an optional tool that's on our website that you can ask specific questions. I've gotten a lot of comments in the exit evaluation that speak volumes, and I'll show some testimony in a couple of slides from here. And then also the provider feedback letter. If you haven't seen that, there's the website link there, but it overviews what they've learned about their health over the last 6 weeks and what they want to do continuing it forward. And then there's also other comment sections there too. But you can really pull from that or see those individuals who really were impacted by the program and maybe ask them to do a story. And then the bottom there, create a feature story or use one that has already been made. Chris Krasnowski is a whiz and is always looking for stories to share and build upon and highlight, so reach out to her. All right, so here's some of the testimony that I've collected over the years, and reading them always inspires me to do more, see the challenges that people have persevered over, and a lot of these were captured on an exit survey or a comment section, and it gave me a flag to look in further to these participants. So I'll just read a couple, but feel free to pause this slide and take a look at it. So some of them was living well helped me realize the circumstances cannot always be chosen, but reactions to them can be. Or this workshop has been eye-opening experience for me to actually realize that taking small, doable steps is far wiser and in the long run more effective than setting unattainable goals. I come away feeling empowered and inspired by a few fundamental, simple lessons. And I think if you are a part of these workshops, that speaks true. You know that you've seen that time and time again. I love using these as an opener to an opinion piece or the beginning of a story, or even that last one. I came into the 6-week program, a death-fearing, self-pitying, chronically ill person, and now I'm mainly chronically well. That's a great way to end a presentation. Just on a high note, a real testimony from a real participant, and then you can even capture a bunch of these and make a booklet if you choose.
Or use these as a start to your elevator speech.
Yeah, very true. All right, so concept number 2 is tying living well to a specific chronic condition. So this may seem new and innovative or new and scary, but I think it's a great challenge and a great concept as well. You really want the program to be relatable, and a lot of times people are just not connecting with the word chronic condition or even long-term health problem or issue or things like that. So this is a way to kind of leg up into helping people identify that, hey, this workshop is for me and I belong in this workshop. So here are some points about how to make this happen. You can market to a specific group of people, so support groups, registry-based referrals, if you have a partnership with a clinic. In the clinic, they can do data dives to pull out those affected by a certain condition, whether it's heart disease, arthritis, etc., and then do targeted mailings or specific calls or outreach. You can do scripted motivational interviewing components to it. So there's a lot of different ways that you can market. Also, you can help your target population identify with the needed program by starting out with, hey, what are you doing right now with your arthritis, or does pain keep you up at night, or anything like that. So just kind of talking with them about what they're currently doing with their current condition, and then talking about the program and what ways it will assist them towards solutions of better self-management. And then lastly, you can market it living well with insert condition name here. But this is no bait and switch because you can't advertise having a certain condition focused workshop without having a robust resource table for that specific condition. And we also highly, highly encourage, if not require, that if you market it for a certain condition, you also have a guest expert come in at the end of that 6th session, once the 2.5 hours is over, or an optional 7th session. And it's a guest expert for that said condition, so arthritis or chronic pain or things like that. So then those individuals who were specifically marketed to get extra support, because we still have to adhere to our fidelity components here and our fidelity standards, where you're not adding or subtracting the 2.5 hours for 6 sessions, but you can add in that robust resource table or that guest expert or something more to help those specific individuals with that specific chronic condition. And what we really know is that the participants bring the flavor. So and they may have multiple chronic conditions, but if they mostly are sharing arthritis, the problem solving and the brainstorms will automatically align with the similar chronic condition and others and ways to approach it and things like that. So
yeah, it's really about having people identify with wanting to take the class, identify with having a blank condition versus a chronic condition. Like they may think, oh, I have arthritis, I'm going to take this class, but I don't have a chronic condition. So that's the point behind this concept.
And with the diabetes program, I think what's the easiest thing about it taking off is people say, yeah, I'm either pre-diabetic, type 1, type 2, and this is for me. So this is a way to help that. But if you have more questions, you just let us know. All right, so I wanted to include this slide because this is what our self-reported survey responses have been from the Living Well program, those health surveys we put out there. And I just want to show that arthritis is the #1 self-reported. Many times people are doing multiples, but then we have hypertension and heart disease and breathing issues, cancer, all sorts of issues that just to see that these chronic conditions more towards the front may be similar to those that are in your area as well. All right, so concept 3 is proactive engagement prior to your workshop. And a couple of months ago, I had a pre-webinar survey asking how many of you do the session 0, is what it's commonly referred to. And it was pretty much split. Half said yes, half said no, and then we had a portion of it as a no answer. So what is it? You can follow that link to the website that overviews the Breaking the Cycle presentation, the session or ground 0. And then today we'll talk about the session overview presentation as well as the health screening plus. But what we want to talk about is ways to use it. So 1 to 4 weeks prior to the first workshop session, you're going to want to start engaging the public in awareness, information, that motivating, that informational sessions about what these programs are and what people can expect as a participant. You can give a taste of those key program components. So talking about action plans or the symptom cycle, or even a high level touting of the proven benefits and outcomes, your local numbers, throw in some testimony, just getting people excited about wanting to be a part of something that others have taken and had impact from. It's an engagement tool is the other way to use it, but I do have the disclaimer that this is not a health lesson. We are motivating people to come to the workshop to become activated in their health. This isn't a time to tell them about their health or health issues or different resources out there. It's to really engage them into coming and identifying with this workshop. And then, yeah, be intentional to motivate, but not overwhelm with information. I think that's a key point that sometimes we forget about. So how it helps It motivates a person to take charge of their health. It eliminates those perceived blocks. By doing this in proactive engagement, you are opening up a dialogue. So if somebody says, you know, I can't sit for 2 hours, or I don't like large groups, or I don't have transportation, that's an opportunity for you as the presenter to say, hey, there's a 20-minute break, or it's a really comfortable environment. So if you need to get up and walk around, lay down, you know, whatever you need to do during the workshop, it's okay. Or, hey, let's see what we can get you connected with for transportation, or just come to the first session. If you can get there, potentially if you can carpool for the next. So just really working with people and having that open dialogue of the barriers. It supports a person in attending. So just working with that assistance or the carpooling or anything like that to help them get there. And then it also creates a sense of urgency. So you can have those golden tickets, or say that says, you know, are you interested in this? I have 7 seats left. Come up and get one of these tickets. I think Harvey and then register while you can, or space is limited. It just helps people go, oh, I'm not going to do this later. I'm going to do this now. And then with all of these practices, follow-up is royal. You know, it's the king or the queen method of getting people in that door. With any and all presentations, you want to pass around an interest sheet or a sign-up form or something that doesn't mean that they are solid committed, but a way for you to reach back out to them and say, hey, thanks for coming to this presentation. Did you have any questions? Do you want to sign up? And then opening that dialogue up again. Or, oh, what are you doing for your health? Like having this more intimate conversation beyond the presentation. And you can eliminate the no-shows or the forgetfulness if you're engaging them in on that level. So just get people excited to attend, and informing them about the program will really help break down any barriers or challenges as they go forward. All right, so now that you know about the concept of proactively engaging people prior to the workshop, let's look at a couple different styles or options of doing so. And this is kind of the baseline, and you can add more to it. So this is a simple, no tech, not low tech, but no tech presentation for us to use out in the community. And what's really great about this is it's time flexible. It can be 5 minutes, it can be 40 minutes. It's just all on what you can do. It is preferred to have a leader present this because they have a lot of energy and experience, and they can tailor it on the fly to who they're presenting to. But basically, it is a paper flip chart outlining each session's activity, and then you can also add in other components to it. So I'm just going to briefly walk through this a lot faster than you would. But this is just kind of the baseline outline of what this presentation could look like. And it's helping people understand what the workshop is about and how they can be a part of it. So you start out with the Living Well workshop. It's a 6-week workshop for those managing a long-term health condition. We meet once a week for 6 weeks for 2.5 hours each session. And the goal is to help you be better in control of your health. Who doesn't want to not do that, right?
All right.
You get a book, and you can talk about other incentives that's locally tailored. And then you just kind of start talking. So session 1, we just do intros across the board. We want everyone to get on the same page about what we're doing. So we'll intro about the workshop, and then we'll learn about each other. And then we'll start to jump in. And then we end the session with an intro to action plans or short-term goal settings. And we'll get into that more at the end of this presentation. Session 2, you know, there's a lot of new activities that happen, but my favorite is the falls prevention and balance. I think that is really impactful, and how to help support not falling or reducing the risk of falls. In session 3, you know, we're making decisions. We're talking about exercise. We're talking about relaxation. And if your local area does a relaxation CD, you can mention that. And then session 4, oh, this is my favorite session of all time because we talk about communication skills, and that goes beyond your health, but that is in your how you communicate effectively with friends and family, your medical provider, or it's about the things that are not said. And so you can really do a dive into a certain activity that you really love. Session 5, we're going to talk more about healthy eating and making informed treatment decisions. What does that mean? And positive thinking, how that can affect us. And then session 6, it's our last session, and so we're going to celebrate. We're going to talk about our future plans and how to carry this activated health management forward. And then you may want to do a demonstration of your action plans, or you want to overview the self-management toolbox and what's all incorporated into that. I've done this a couple times, and people really enjoy it because they're like, oh, yeah, now I understand what's going to happen, and now I'm not so reluctant. And again, it opens up that dialogue for people to talk about, ooh, small group, large group, groups in general, and being able to take a further conversation with them about that. So, and then again, I'm going to emphasize follow-up. Have a sign-in sheet. Pass it around so you or a leader can follow up with those individuals who attended, either get them signed up or anything like that. So with these, this is from the survey that I gave out a few months ago. Just pause it. You can read through them. We're not going to read through all of these, but it's just positive experience that leaders and or coordinators shared with WIHA about pre-workshop engagement. And so feel free to pause it, but we have both positive and the negative experiences. It's important to see both sides and hear all of those. And then some other experiences as well. So feel free again to pause and read through these, but I think it shows some great experiences that people have had in the pre-workshop engagement.
Well, thank you, Michelle, for outlining a basic, simple way and strategy that we can use this proactive engagement. Now, what I'm going to do is talk to you a little bit about some add-ons that you can do, and was inspired about these ideas when Michelle and I had the opportunity to be in Washington, D.C. for a grandees meeting, and we heard other states talk about this specific topic. We went to a whole presentation dealing with proactive engagement and how some different states are doing it. So really cool ideas that we would like to test out here in Wisconsin. One of them is a simple no-tech flip chart presentation, so Michelle just described, plus a health screening. We know that people love to come and get free health screenings, whether it's blood pressure, cholesterol, just doing like a finger prick for blood sugars, weight, BMI, grip strength, like those just general on-the-go fitness assessments, balance, partnering with your local healthcare providers, with clinics and healthcare centers will be an awesome opportunity for this because they can bring those screenings very easily to the community, to a local church, to wherever you are. Yeah, they can travel. They are very used to doing it. Yep, and it's easy for them to do that. Or even just a health educator, public health nurses. We have lots of options for people to partner with to do this, but people will come to a free community health screening pretty easily, especially I've seen it been done. I used to do it all the time when I worked in southern Wisconsin for a clinic down there. So definitely it's a popular idea. So it's not like you're really trapping people, but you're enticing them to come to a free health screening, and then you're giving them health information. You're going to talk a little bit about the program and the opportunity for them to sign up. So another way that you can do this is pairing it with a mini health fair. So some of you have health fairs going on in your communities already. Most of you probably do. But just having Michelle's flip chart that she talked about, having that at a table or in the entryway or where as people are leaving, however you feel like you want to work this. But you can be doing a health screening, or health screenings can be going on. You can have resources depending on different chronic conditions. You can have a past participant or a leader there with you. And you can sometimes even do the mini presentation that Michelle was talking about. But just, having little activities on your flip chart or little the self-management toolbox or some little giveaways or whatever you want to do. But just use the opportunity for a mini health fair, either whether you're organizing it yourself or you're going to one that's already organized to help kick off people being engaged in the Living Well program.
Again, having that sign-in sheet to say, it just can be as simple as saying, are you interested in learning more about said workshop? And if yes, here's my phone number, great, and then you can follow up. I also have this little post-it note thing. As it's a way, even if you're tabling at an event, to engage people with your table. We've done this a lot when I was a coordinator. We'd say, what are you doing for your health? And people say, eating my vegetables, and then they put it on there. Or we had a cute little 6-year-old come up and he wrote, I run a lot, I eat good, and I get wild. It was so cute. And I still have that post-it note because it was just the cutest thing ever. But it's a way for the community to engage with your table, engage with what are you doing for your health, and it opens up that dialogue, and then you can tell them more about the program, and then taking advantage of other resources that you have and services.
Right, so we're going to talk about partnerships to incentivize, and I just want to quick make a note that all of these concepts actually have theory behind them, which is what we're talking about. We just finished talking about the health screenings, and the theory behind that is behavior change theory. So when people are going to these session zeros or looking to partnership or coming to health fairs, they're really in that contemplation stage where they're contemplating what are some things that I can do for my health, what are ways that I can be healthier, and what you're going to do is you're going to provide them a way for them to take an action and move on to the next stage of behavior change, and that's the action stage, which would be signing up for Living Well class and coming to the Living Well class. So it really fits within the theory of behavior change. So keep that in mind as we're going through these concepts. So partnerships to incentivize. So different ways that you can get sponsorships for the program is also a concept. So talking with local groups, local communities, they might donate a little tchotchke, like they could, Culver's can donate a hat that say Culver's on it or whatever it is. They can sponsor a workshop by just giving away little items.
Community-based resources that here's the water bottle, here's some magnets, but it's a way to keep, once the participants are in the workshop, to keep them coming back to see what's that fun little tchotchke they're going to get this week and connecting it to something in that session. And I do have to caution that it's a little extra work in transporting and storing, but it is those little things that go a long way.
It's just something little each session that you're giving people. It's not a way for it's not a lot of money. It's not a lot of sponsorship when it comes to that, but it's just little items here and there to make it more fun.
And then if you feel like 15 items times 6 weeks, or even just doing it 3 of the sessions, some people have taken a different route and created a basket at the end with a bunch of the sponsorship items or tchotchkes that each participant will get 1 raffle ticket per session that they attended, and then the drawing is at the end. I think some of the feedback I've gotten from coordinators of this concept was, oh my gosh, I didn't realize I could do that. And I think, why not? I mean, if it's just the swag that they have laying around, participants love it. Like, I've never seen someone so excited about a water bottle before or a reusable grocery bag, but it is cool and it is something local and
and it helps with creating partnerships, because then your local agencies and your banks, people that you wouldn't normally think as traditional partners, are bought into the program, and that kind of creates a Living Well movement in the community.
Yep, and more awareness, more people, more talking about it, word of mouth, all that great thing. I do have these 2 books on here. Do you remember if it's N4N?
N4A.
N4A. They have this great free exercise book in both English and Spanish. It's about 120 pages long in color, and you can go on the website. I'll put it up on our website too, but you can order a box of 25 at a time for free. And so I'll order it, Jill will order it, my sister will order it, and then we have this great exercise booklet to hand out for free to incentivize people to keep coming back and seeing what the and giving more information as well.
Very high quality. People love them.
Mm-hmm.
Okay, so more about partnerships to incentivize. Another session that I was able to attend at the national conference had a state, actually California was the state that was talking about the ways that they did this. And what they did is they created a wellness club, or they created a punch card system. And they did it two different ways, and you could do it two different ways. One is if people are if you're in a community and you're offering multiple programs, so let's say you're offering Stepping On, Living Well, Health Living with Diabetes, Powerful Tools, Strong Bodies, whatever it is, whatever programs you're offering in your community, to create a wellness club punch card. So when they take one of the classes, and it could, I think the example on here is 10, but you could do 3 or 5 or whatever it is. Or if they even attend other events that aren't necessarily evidence-based programs, but you have your wellness club, and when they take a program, they get a punch card, or they get a punch on that one, and then they'll be walking around, and then they take Stepping On, and then they take Walk with Ease, or whatever it is. They get punches, and you can incentivize per each one of these punches. Like when they get all their punch cards filled, they get a T-shirt or something larger if they're taking all your programs. But it creates actually more of a buzz within the community. Like, ooh, I've got a punch card for this is the wellness club that I'm doing in whatever it is, Columbia County. Or you can do it according to session. So you can say the Living Well program, you can have a punch card for the 6 sessions, and they get a punch every single time they come, and they use it for the incentives. You can do, like I said, combine it with health screenings, and then have all of your donated items accordingly. So the California, they actually had T-shirts made, and they were like bright green T-shirts, and it said something wellness club, and so people were walking around the city and the community with these T-shirts on it, and it upped the marketing and the recruitment like crazy, because, oh, where did you get that T-shirt? I want to be part of that wellness club. How do I be part of that wellness club? Well, sign up for this program and blah, blah, blah. So it was just a really cool way to increase awareness in the community, to incentivize the participants who are already taking it and get new participants and build the awareness. They actually, too, did have little cars that drove around the community whenever their Living Well leaders would get in these white cars, and it would have like this logo on the side of them, which I have no idea how they could afford all that. But really cool, because then it had the club name on the cars, and so they would see these Living Well cars driving around doing the Living Well program. So
locally, I heard that I believe it was, I don't know who it was, but they had a health screening at a clinic, like kind of like a card where you got to get your eye exam, your dental, your yearly physical, and check, check, check. And the coordinator there asked if an evidence-based programming could be added on there. So I believe they put Living Well with Chronic Conditions, or Living Well on their wellness workshop, to then make it another additional check. So then when they got everything checked, they would get a pair of shoes, or a rebate for a pair of shoes. So that was really great to incentivize. Okay, yeah, sure. And it's all steps towards better health and health outcomes.
okay, so different unique partnerships that we can discuss when it comes to Living Well. Just in a lot of these ideas we've gotten from all you all, we just wanted to take a slide to acknowledge it, because it is quite large, and we know that this takes a lot of time. It's actually what my position is based around, so definitely don't hesitate to reach out to me, talk a little bit about different partnerships that are going on, and of course, talking to each other, because you all are doing wonderful work with different partnerships in your area. But talking about referrals, getting your case managers, care managers, community health workers, pharmacists, any kind of health professional to help refer into the program. We've got lots of resources on referrals. Michelle's worked on it quite extensively, as have I. So we're happy to help give you tools and all those kinds of good goodies when it comes to referrals. And then identifying leaders within organizations that you wouldn't necessarily think of, like employer groups. They have employee wellness programs. They have educational series and things like that. Really talking with them, because we all have the same goal, and that is whether it's within one building or the whole community at large. So identify those leaders in your community who are working on wellness along with you. And then some other partnerships to add some extra spark to the program would be like your recreational organizations, faith-based organizations, different like salons, your corner stores, your corner stores, coffee shop, different things like that throughout the community that are areas where people gather, areas where like the hairstylists will talk to their customers as they're doing their hair, have them be your champion for the program. They, I'm sure, get to hear about people's aches and pains as they're cutting their hair, and they can mention this program, gives them, of course, some supplemental materials like brochures and things like that. And then, of course, intergenerational, parent-child clubs, after-school programs. The state of California, which I was mentioning on the slide earlier, did a lot of this intergenerational stuff, where they looked at different child care centers and different schools, and promoted the program through the parents, different things like that. So lots of opportunities here. Don't limit yourself to just your traditional partners. Definitely think intergenerationally. Kids have parents, they have grandparents that all need this program.
Yeah.
We all do.
And I think it was 2017 at our Healthy Aging Summit, one of the STAR awardees, their bright idea was connecting the program, the Healthy Living with Diabetes program, to an after-school program. So when the parents would drop their kids off to have childcare, they would go to a workshop and then pick the kid up afterwards. So it was a way to reach that younger population, maybe the working population, but then connecting it to another partnership of after-school programs.
And having the workshop be at that location, having the workshop be at the YMCA, or having it be at the schools themselves. Lots of different.
Yeah. All right, so this slide here is a little bit of a teaser for a future recorded information video or info video that we'll create, but it is something that I wanted to highlight as a place to engage the right people into these programs. So just in a nutshell, this is a way to talk about direct referrals from a healthcare setting into your community-based workshop, and what that looks like, and how you can make this tailored, proactive approach that you, your organization, the clinic, and that patient all make sense to them, and it works well. And so there's a lot of steps in between these steps, but that big one with the big red circle, partners must come together to make a referral process that complements the current system, outlining everyone's roles and responsibilities. And this is really important for sustainability and keeping in line with what the steps are, and again, everyone's roles and responsibilities. So then people have a stake in the game, and then success can happen. But basically, whoever the health provider is would recommend the workshop to the participant. Hey, I think you could really benefit from this workshop. This workshop exists. Would you like to know more about this, or can I set up a referral? The patient says yes. However that referral is sent, again, this is going to be a tailored approach. Each system is different, but don't reinvent the wheel. That gets sent to somebody who's going to navigate that process. That person then will be contacted or connected into the workshop to help them register, to have a conversation, that motivational interviewing, to attend a workshop. They get activated in their health. There's a 7th session with a health expert or a healthcare provider to then say, all right, you're now activated in your health. You've taken this 6-week workshop. What's next? I'm here to help you. Here's my number, things like that. And then the provider feedback letter, that template that we have online that we've talked about a lot, that can also be sent to their provider to close that gap on, yep, they attended, this is their goals, talk about it in their care plan, and then it incentivizes the provider to read that and say, oh, my patient attended and they got a lot out of this, I'm going to keep referring. And then you're going to want to meet back with all those puzzle pieces, all those hands coming together and working on this concept to evaluate the process and see if there's any tweaks that can be made to make it even better for everybody overall and make sure that it's still complementing the system. So again, a lot of steps, a lot of variances that can happen, and we'd love to create another video for that.
Well, so you've heard quite a few concepts today, but what we want to just reiterate is that let's reach more people, let's change more lives, let's improve the quality of life within our communities, and of course save healthcare dollars. And it's not an exaggeration. We know, and you've all been there. If you're a leader, you've had people come up to you. I've had someone come up to me and said, this program has changed my life. So let's do this. We can take these concepts and these strategies, try them out and see what works in our communities, and let's revive this program because living well is needed. We help people begin the process of being involved in their health. We're giving a little bit of health information, yes, but what we are doing is unique. We are empowering them and we are increasing their self-efficacy so that we're giving them the confidence to be able to access all the health information and health resources out there from their healthcare team and anyone else that they come into contact with. We're giving them that baseline confidence that they can take that information and they can apply it to their life. So we're encouraging local areas to come up with a plan to scale up and outreach efforts with the Living Well program, increasing your program providers and other staff champions. And we challenge you to be focused and intentional with your plan. Have a timeline, and don't feel like you need to take on all these concepts. It might be a little overwhelming. Probably should have said that in the beginning, but really just pick one or two. And really be intentional with it because intentionality is really going to get the results that we want. We don't want to just skim the surface on a variety of these different strategies. Take your time with them and figure out what works. Contact Michelle or I. We'd be happy to hear how things are going. And of course, we'll have opportunities. You know us. We have opportunities for you all to share with each other too.
All right. And then in conclusion, this is just kind of the whole wrap up of our presentation. I have different strokes for different folks up there. What is it that you want to start with first? And as a coordinator, maybe I'm doing the presentations with a leader, or maybe I'm writing, but then my leaders are doing the presentations, or everybody's doing elevator speeches or referral cards. So, figure out what works for you to bring and build awareness around these programs. Who's that one-on-one partner champion building that's going to go out and be able to do that? And not everything for everybody at that one time, just like Jill was saying. That pre-workshop proactive engagement, calendar it 4 to 6 weeks prior to the workshop. We want to go beyond the brochures and flyers where they're still really great. That bronze level flyers, letters to the editor, advertisements, radio, etc. That's really important because it takes a couple different touches before somebody actually takes action on those things that they're being touched with, if you will. That silver level, informally talking to others about it, whether it's your elevator speeches, your pitches, your some presentations a little bit, having MAs say, hey, here's a brochure, I think you should take it. That's still silver, but those gold standard is the things that all have follow-up to it. So presentations with follow-up, a champion encouraging it with follow-up, events with follow-up. You really want to have a further dialogue about why this person should take this workshop. What are they doing? What could they be doing? And how the different pieces of these workshops can help them. And so that tailored, proactive conversation to motivate and encourage. Also in that gold level is targeting a population with healthcare providers or employers, helping them identify that this workshop is for them. Again, living well with chronic conditions is really generic, but we really want to focus in because we know that even though people are or are not facing the same challenges around the table, they're having the same condition around the table, they're facing the same challenges. And they bring that flavor again, where it's helping one another out through this 6-week process. So we really want everybody to attend these programs, whether they're 20, whether they're 60. I think you can get so much out of it and helping people identify with that. Partnerships, we want to talk about barrier reduction, referral sources, incentivizing new leaders. Partnerships can bring and help with all of those components. And so partnership isn't a one for everybody. There's different pieces where they can help in different facets. And then always speaking about the value, how the program is a value to that person. So that value proposition that we've talked about, and make it relatable. So, all right. So we want to say thank you. We believe in this program, and we believe in you too. And we want this to be successful, and we want less cancellations and all that good stuff. So we really hope that you enjoyed this information presentation about living well engagement. Reach out to us. We're here to help. And look out for more info videos coming soon.
Thank you very much.